And often bladder is optimally full when it covers the, where's the notch on this thing? Maybe that one? So can you bring your pants a little bit lower for me? Uh-oh. Did it break? It's a little bit lower here. All right, so Laura is optimally full because her bladder is covering this fundus. Okay, so I am, healing the probe. Let me show you the difference. If you toe the probe, even on her, you can still see. Remember, the probe is like a foot. So the top would be toe, the bottom would be heel. So a lot of times you guys will put the probe toe like this. And especially when the bladder is not full, what happens is it doesn't cover that fundus. Versus, look at the difference when I heal. My probe is like this. I heal the probe, and now I can manipulate the bladder to be a better window, and it covers the whole uterus. So I can see all the way from, the vagina here, here's cervix, and then here's the fundus. Your first image, your first two images, there's two measurements. The first one, you want to get the uterus long axis to include the cervix. So the objective is to really kind of rock your probe and fishtail it at varying angles, because the uterus typically doesn't fully align median sagittal in the body. Often, like, the fundus is tilted a little one way or the other, or maybe the cervix is one way and then the fundus is tilted one way or the other. It's not always straight in the body, or it's rarely ever straight in the body, to be honest. So when you're trying to find your long axis, you're doing this little fishtailing and towing and healing. And if you look for the endometrium and try to follow that down to the cervix and look for the fundus pretty clear here, that's when I like to kind of take the center part, the endometrium, and look on each side. Are they equidistant versus here? It's a little off-centered. So when it's equidistant, I can see the fundus with the vagina here and the cervix. This is where you're going to do your long axis to include a length. So from the tip of the fundus to the cervix here, the end of the cervix. And then you're going to do a second measurement where it's at its thickest, which is usually the body. This is your AP measurement. So you have two measurements here for the first picture of the uterus. Okay, so that's your long axis, including the cervix. Your next one is the midline to include the endometrial canal. So this is where it's going to get a little variable based on where a woman is in their cycle. Okay, that means like the endometrium can either be very thin, it can be multi-layer, it can be very thick, before all those different phases that you guys have learned about. So what you're going to do is hyper focus on the endometrium, and I'm going to zoom in a little bit here. And hers is pretty thin. Did you just have your cycle? Where are you in your cycle? Okay, so she's still early proliferative phase, and it's just this tiny hyperechoic. In fact, I'm going to zoom more. This zoom is a little funny. To take a measurement of this hyperechoic line here. Now, if it is multi-layer, then you might see hyper, hypo, hyper, and then again, hypo, hyper out, and you do the whole thing, the whole multi-layer. If it's right before menses, then it's going to be thick and hyperechoic. Okay, so generally speaking, your endometrium will be the best place is more within the central part of the body here. And then you want it to be pretty even all the way down. That makes sure that you're not slicing it oblique and getting an incorrect measurement of the endometrium. So you do an AP of the endometrial canal, and that's your second picture here. I'm going to just kind of sweep through back and forth to be sure that I'm on the, you can see it a little better here. Can you guys see it a little better there? So nice and thin. Okay, so that's the endometrium. Now, the next two pictures, we're going to basically sweep right and sweep left. Okay, so in your textbook, I think they have like uterus 1, uterus right 1, uterus right 2, or something in the protocol. And the idea is you're just trying to sweep all the way right and left to ensure that you don't see any type of basically fibroids or masses, tumors that are hanging off the right or left aspect of the uterus. Okay, so once you find the long axis, then you're going to, I'm going to go right, I'm going to go left and get an idea. Now, if that patient's fundus is tilted more left, when I go left, I'm going to see more fundus and less maybe cervix. If it's tilted more right, then vice versa. Okay, so when you ask me what should it look like, it's going to depend on the lie of that person's uterus, the shape of their uterus, all of those factors. Find your midline and rock right and left, and that's going to give you an accurate depiction. It's kind of oblique, right? I lose the endometrium. This would be the right side because I swept to her right. I'm going to just clean up that bladder a little bit. I swept to the right. Okay. These are fun to play with here on the screen. And then when I go to the left, it looks a little bit different, right? But I want you to practice going all the way out and then all the way back to midline and then kind of go back. So that would be uterus left. Now we're going to work on the right side of the body. We're going to do right ovary, and then we're going to sweep out to the adnexa, and then we're going to do left ovary and sweep out to the left adnexa. It's best if you do your survey kind of of both sides, because ovaries aren't always just like, here's uterus, here's ovaries. They're not always perfectly positioned. They're variable in their position on everyone. So when I'm looking to the patient's right side, what I'm going to do is I'm going to slide over to their left side, and then I'm going to angle through the bladder. You guys see her ovary popping in here? I'm going to angle through the bladder to go to the right side. When I go to the left side, I'm going to slide to the right side, and I'm going to go to the left. So here's her other ovary right here. This is the left ovary. Now, when you're in a sagittal plane, I have to trust that you know your right and left. Okay, now things that I'm going to look for and that you need to look for that's going to help you determine, am I on the right ovary? Okay, or I should say the correct ovary, not the right one. It could be right or left. The correct ovary is practicing also going in a transverse plane. Okay, so now I'm transverse, because when you're in transverse, we see right and left, right? So we know we use the uterus as the midline structure. If it's on this side of the uterus, we know it's left. If it's on the other side of the uterus, we know it's left. So that's, it's not always going to be this simple, like what we see on Laura. You're going to have to search and change planes and kind of convince yourself that you're on the correct ovary. But a few things that I'm going to look at while I'm in a transverse plane, I'm going to say, okay, what part of the uterus am I on? Is it like more superior, or am I down closer to the cervix? Okay, that'll help me know when I'm sweeping in a sagittal plane, is it higher or lower? Another thing is its closeness to the uterus. So here's my uterus, this right ovary, when I start to sweep, it's just past the uterus, or I possibly can see the uterus with the ovary because it's very close, versus this left one, see how there's a space here? So it's a little bit further away. If I saw the left ovary way up here high, that means when I sweep, I'm going to be sweeping way past to the left and up high. So going back and forth in your contralateral planes will really help convince yourself and feel confident that you're representing the correct ovary and that you're actually on an ovary and not a ligament, okay? Or making up an ovary, because it's, sometimes you guys make up ovaries. Everyone makes up ovaries sometimes when they're hard. So I'm going to go back midline, and I'm going to slide my probe slightly to the left side, and now I'm going to angle through, because we're using the bladder as a window. I'm going to angle through the bladder, and that's going to help me kind of centrally locate this ovary here. I like to zoom in on the ovaries. Where's my field of view? Sorry, I'm working on the what? That's field of view there, but I want to zoom in. Where's my zoom thing? Position. So I'm using the trackball for the position. Maybe it doesn't allow me to change my zoom sector. All right, so I'm just optimizing it. I'm going to keep kind of twisting my probe to try and get the borders as clear as possible. Notice how this looks almost like a chocolate chip cookie. She's got lots of little follicles all the way around her ovary here. And I'm going to twist till I can get it kind of almond shape or ovoid. And then for sagittal, I'm going to do one measurement. Okay. Some things to think about when you're looking to confirm an ovary. If I use color Doppler, my iliac vessels are going to be posterior to the ovary. See the iliacs? So I'm never going to see the ovary posterior to the vessels. You see the vessels posterior to the ovary. Okay. So that can be helpful in confirming, the borders, or also I'm going to turn a little bit on it. And sometimes that helps me determine its shape. So this is transverse. And then I'm going to turn back sagittal. Let me turn my color off. And there I got a little bit better border. So this would be right about there. Okay, so that's the length. Now, sometimes when you're in a sagittal plane, like sagittal on the body long, you might see it more round. And sometimes when you're in a transverse plane, you might see it more long because of their variable lie. So the best thing to do is to kind of rotate the probe to get it at its longest point. Okay, and take the longest, like I'm not going to measure my superior to inferior like this. I'm going to go, even though it's at an angle, it's at its longest kind of tip to tip, I guess you might say. Is this making sense to you guys? Okay, so I'm going to unzoom because the next thing we're going to do is do the right adnexa. So the adnexa is a space. It's not a one particular landmark. Like ovary is an ovary. You find the structure. Remember, the adnexa is the space lateral where the ovary is located in. So for this one, the idea is we're going to go all the way out to the pelvic sidewall because you want to scan to make sure there's no masses, there's nothing hanging out past that ovary. So in order to do that, you're going to go more to the right side. I see ovary here. I'm going to pass the ovary all the way to the pelvic sidewall. I'm going to increase my overall gain. This is my pelvic sidewall, this pelvic bone. Okay, that's what I'm seeing. And these are my iliac vessels. So if you ask me what landmark you're looking for, I know you've gone all the way out to the right adnexa as far right lateral as possible when you see these landmarks. Okay, so this would be good for a right adnexa. Now I'm going to go back midline. Midline's kind of like your starting point always when you're working from right to left. So I'm going to go midline where my uterus is. I'm going to slide to the right side of the body, and then I'm going to start to angle towards the left and see how that structure pops in and out. Uterus, it pops there, right? If I'm on a muscle or a vessel, like watch this here. When I change planes, that structure elongates more. Okay. Here, I see this little hypoechoic thing. Oh, that's an ovary. When I turn on it, it's elongating. Okay. If it's truly an ovary, when I turn on that structure, it keeps a similar shape, right? Similar echogenicity, similar appearance, similar size. All right, so when you turn planes, if the structure elongates, that's not your ovary. Okay, so here would be my left ovary, and I'm going to take the length of the left ovary here. Okay, now I'm going to increase my depth some. I'm going to go all the way to the left side. Here's my pelvic sidewall here, and then here's my iliac vessels. So this would be left adnexa, this space from where the ovary is all the way. These are bowels, vessels, and I know I went all the way to her sidewall there. So this would be the left adnexa. Now, not all ovaries are going to be this simple and pop out at you guys. I mean, you guys probably will all look like this because you're young and probably fertile. But when you're looking and you're questioning if something's an ovary, push on it. If I push on it, just like I kind of, and their bladders are full, so don't like keep the pressure too much. They might pee on you, but this doesn't move. If it is bowel, which often bowel is what you guys kind of make a shape of you'll take bowel and you'll kind of twist your probe and make it look like an ovary, right? If you push on it or it starts to move when you push on it, it's peristalsing, it's moving, it's not an ovary. Okay, so that's another technique that helps you know. And I'll put my color on just so we can kind of see the vessel posterior to it. And I can actually see internal flow. The last part of this protocol sheet, the Doppler, you guys will do in second year. You guys aren't going to be Dopplering the ovaries this time. When you get a little bit more used to it, it makes it a little bit easy. You guys are working on your Doppler now, so it should get better. All right, so those are your sagittal images. I'm going to sweep through one more time and show you. I'm going to elongate to take a measurement. Okay, I'm going to get the endometrium. I'm going to sweep uterus right, uterus left, right ovary, right adnexa, left ovary, left adnexa. That's all of your long images. Now we're going to turn transverse. The first image is the vagina. So this structure here that I saw in sagittal, hers is, typically they're longer and more narrow and thin. You have an echogenic center. And remember, this is superior, this is inferior. So the vagina is most inferior. So when I turn transverse, I'm basically going from an inferior to superior motion to rock through vagina, cervix, uterus body, uterus fundus, unless it's an alternate shaped position uterus and it's flexed or something, then you have to reframe your thinking for those variable position uterus. Okay, so doesn't mean your probe's always straight transverse. Remember, if their uterus lies like this, when I go transverse to get axial, I have to be axial to the plane of the uterus, right? So I might have to, in order to center it properly, I might have to rotate my probe at varying angles. So all the way inferior is the vagina. It's just this hypoechoic strip here. This is the pelvic floor. These are the levator ani muscles here along the pelvic floor, the support system, okay? So if I kind of rock all the way through, I can see uterus fundus, there's my cervix, and then I go most inferior, and this is going to be the vagina here. So vagina, and I start to go more superior. For the cervix, you're going to look for a shadowing, kind of like walrus teeth, right, that come down. You guys can picture that, like the cervical canals here, and then the teeth kind of come down the shadow. I don't know, that's what kind of looks like that to me. You guys can make up whatever it looks like to you guys. But the shadowing of those vaginal fornix helps you know that you're in the cervix, okay? And then if I go superior and I see the centrally located endometrium and the uterus body gets a little thicker, I know I have to angle more inferior for the cervix. So here's her shadowing here. So this would be the cervical canal right here. So this would be cervix. Can you guys see the shadowing? Now I'm going to do, you measure at the level of the body, and the body's going to be kind of the widest point where you kind of see, I don't want to say wings, but the top part, the more anterior part, looks a little bit thicker, and it helps you know if you're even because you can see that centrally located endometrium. So this would be the body. I'm going to go from width. There's 2 measurements to AP. Okay. So that is your body. And then the fundus, I just want you to think of this little tip of the uterus, the fundus. So go all the way up superior, and it should be a little bit more circular. And here's the fundus. Okay. And then lastly, we're going to do right ovary and left ovary and transverse. So same technique to go to the right side of the body. I'm going to slightly slide to the left and then angle superior to inferior and sweep to the right side to look for the best window for that right ovary. So right around in here. And then I'll take it. I'm going to find the ovary, and then I'm going to make tiny little adjustments to optimize its view. And it should look kind of almond shape, ovoid, and then do 2 measurements in transverse. Okay, so that's right ovary and transverse. And now I'm going to come slide to the right side a little bit, and the sound beam is spanning to the left side, superior to inferior. And I'm going to hyper focus there on this left ovary, making it nice and crisp and convincing. And here's my width. And an AP of that. Okay. And then if you see ovaries, it's not a required picture, but you know, if you see bilateral ovaries, you can always show off, and you could always put, you know, bilat ovaries and put like right, left, or L and an R, or just put bilateral ovaries just to show off. You don't, it's not always possible to do this, but if you want to show off a little bit, you can take that as your last picture there. Any questions? No? All right, that was pretty quick. So now you can go empty.